Hello, Miss Kay. My name is Linda Helps, and I will be your nurse today that will be doing your physical exam. So it's nice to meet you. I want you to know that at any time during the physical, if you have any questions, just be sure to stop me and go ahead and ask. I'll be telling you about each thing that I do as we go, so it won't be any big surprises. Okay. All right. Now, I will be sure to protect your privacy, and your confidentiality will be maintained throughout the process. Please, let's see. Okay, I'm going to take your vital signs, so your blood pressure and your temperature and your pulse and respirations, and they're all within normal limits. So that's all very good. Now, I'm going to say 4 words, and I want you to remember them. And in a few minutes, I will ask you to recall them to me. Okay? Brow, tulip, fun, ankle. Got that? Brow, tulip, fun, ankle. Okay. Well, I'm going to just touch you here and there. Your skin, pinch you. Got good skin turgor. Your temperature is warm and your skin is moist. Your skin seems to be clear of any lesions. I have some presence of some freckles and some benign moles, and that's fine. Okay, you have a tattoo on your left shoulder and your right pelvis. And I don't see any swelling. Now I'm going to touch your head. Okay, your head has normocephalic. You have wavy, coarse texture hair. I don't feel any lumps. Did you have any tenderness? Okay, no evidence of pest inhabitants in your hair. Scalp is tan and pink like the rest of your skin that I see on your face. Moist with no lesions. Let's see, your eyes look even and they're on the upper third of your face. Now for your 5th cranial nerve evaluation, which is the trigeminal nerve, I'm going to touch you at some different areas on your face. I want your eyes closed, and I want you to tell me where I'm touching you when you feel it. Okay?
Okay. Forehead.
Which side?
Left.
Okay.
Chin. Cheek.
Which side?
Right. Forehead. Right. Cheek. Left.
Okay. So that is evidence that your trigeminal nerve is intact. Okay, now I'm going to ask you to clench your teeth repeatedly. Okay, good. Your masseter muscles are strong. And do that again, please. And your temporal muscles. Good. So that's intact. Let's see, your face, on the facial nerve, the cranial nerve 7. Can you smile for me? Okay, and you can relax. Okay, facial expressions are symmetrical with no facial drooping. Let's see. Okay, now I'm going to I want you to close your eyes, and I'm going to try to open your eyes, and I want you to resist it. You don't have to take your glasses off. Okay, that's good. So that's intact. I see you have some pretty eyelashes, and they're evenly distributed and they're everted on the upper and the lower lids. No scaliness. Eyebrows are symmetrical, dark brown, no lesions. Wearing eyeglasses, are they prescription?
Yes.
Okay. Let me look at your hands. I want to feel your nails. Okay, they're firm. Have a 160-degree angle on them. No clubbing. No biting. No discoloration. Your nail beds are pink with a return within 3 seconds on your capillaries. That's real good. Okay, can you tell me those 4 words back again?
Brow, tulip, fun, and
It's hard, isn't it?
I don't remember the 4th one.
Okay, well, if it comes back to you, let me know.
Okay.
And I'm going to ask you again later to tell me the 4 words.
Okay.
All right. Now, on your cranial nerve 2, that's your optic nerve. And I have a Snell chart over here for you to read. And I'm going to have you put your hand over your eye. So if you'll put your hand over your right eye and tell me how far down you can read on the chart.
F, G, S, T, P.
Okay, good. Now if you'll change your hand to your other eye. Okay?
F, G, C, T, P.
Okay, thank you. So with glasses, we have 20/20 vision. Now, if I had an ophthalmoscope, I would be looking into your eyes with a light, and I'd be looking for the red reflex of the retina, and the black dots, which is the optic disc, and the retinal vessels, the macula, and observe the general background. But I'm not going to be doing that with you today. However, I am going to shine a little light in your eye. There we go. Now if you'll just focus on my forehead, please. Okay. Okay, so Perla, pupils are equal and reactive and round. Pupils are equal, round, and reactive to light accommodations. So that's, did it roll off?
I think so.
Yeah, there it is. Okay. All right, now the cranial nerve 3, 4, and 6 is the oculomotor nerve, trochlear nerve, and abducens nerve. And I'm going to get behind you and ask you when you can see my fingers moving to your peripherals. Okay? But I want you to look I want you to look forward.
Okay.
Okay, tell me when you see them.
I see him.
Okay,
I see him.
okay.
I see him.
Okay, good. So that's evidence that those nerves are intact. All right, now we'll look at your ears. Ears are symmetrical. Let me know if you feel any tenderness. Okay. They have immediate recoil, the auricles, no tenderness, tragus, and mastoid process. This is the tragus right there. Is that sore?
No.
Okay, good. Okay, let's see. Your nose is midline on the face without deviation. Frontal and maxillary sinuses. Feel those. Put my hands on your face. Tell me if you feel any tenderness. You okay?
Mm-hmm.
Okay. I'll go ahead and feel on your neck here. Okay, it's not a free massage. Okay, all right, I want you to put your finger on one of your nostrils and breathe in and out. Okay, and now on the other side, please. Okay, nostrils are patent and clear. Now, while we're working on the nose here, I have, let's see, what is the name of that cranial? Oh, yes, the cranial nerve 1 is the olfactory nerve. And I want you to close your eyes and tell me what you smell.
Coffee.
Yes. Okay, keep your eyes closed. Have one more fragrance.
Eucalyptus oil.
Mm-hmm. Okay, good. So your nose is working very well. Lips are in place on the lower third of the face, symmetrical, pink, full, moist, without lesions. Okay. Now I want to look in your mouth. Open up, please. Okay. Tongue is, okay, you can close your mouth. Okay. You can put your tongue back in. The buccal space is moist. No lesions. It's pink. The teeth are in white and in good repair. Looks like you have a permanent retainer on the back of your lower teeth. The gingiva are pink with slight stippled without edema, retractions, bleeding or lesions. Yeah, okay. Okay, now hard and soft palate white, hard palate white, soft palate pink, continuous to it, smooth. You can see the transverse ragu on the hard palate. Let's see, your tonsils are present, about a 1+ on the sides. No pustules or exudate on your tonsils. So that's, now for the cranial nerve 9 and 10, which is the glossopharyngeal and the vagus nerve, I'm going to ask you to open your mouth and let me look in and say hello.
Hi.
Okay, you can close your mouth. The uvula is midline. It rises and falls when you spoke to me. Now the dorsal side of your tongue, which I started to talk about a minute ago, is moist and roughened with papilla, a little bit of white coat on there, which is normal. Now I'd like to look at the bottom of your tongue. Okay, good. I see that it's shiny and smooth and glistens with the veins, and there's saliva present. Now the cranial nerve 12 is a hypoglossal nerve. Let's see. Now if I could get you to just stick your tongue out and you can put it back in. Okay. It's midline and it looks good. Now I was feeling up your neck a minute ago, and I didn't see any scars or lesions on your neck. A little bit of light colored hair, which is good. No, symmetrical. Okay, let's check your range of motion on your neck. If you could extend it. Now hyperextend it. Okay. Now forward. Okay. Now down. Okay. To your left and to your right. And then rotate. Okay, I don't feel any crackling. Okay. The trapezius and the sternocleidomastoid felt strong when I was feeling at that a while ago. Now, on your cranial nerve 11, that's the spinal accessory nerve, it felt equal, the muscles felt equal and strong with the movements when you were resisting against my hand. Now, I had felt on your occipital and subauricular, preauricular, jugulodigastric, no nodes, palpable, no lymphedema, submandibular, mental, superficial clavicular, posterior cervical, deep cervical, and supraclavicular. I don't feel any nodes or swelling in any of that area. Now I would like to listen to, feel your carotid arteries, and then I want to listen with the stethoscope. Before I listen, if you'll hold that in your hand and warm it up, it'll feel better. Okay. Okay. Regular and equal. Okay, now let me listen to it. Okay, if I could get you to hold your breath for just a second. Okay, you can breathe and hold your breath. Okay, no bruise. Okay, now I'm going to do some percussion and to listen to the echo of your lungs. Now I'm going to start from the back. Okay, good resonance on that. Good hollow sound. Let me do right here. Good. Okay. The skin on your rest of your thoracic part of your body is tan, pink, clear without lesions. The AP to trans diameter on your chest is 1 to 2. The spine is midline with an S shape on lateral view. No lumps, pain, or tactile firmness. Oh yes, I want to check your expansion. So I'm going to sit behind you here. Okay, exhale. Now inhale. Okay, exhale. Okay, good. So we do have good expansion there in the appropriate area. Okay. How are you feeling so far?
Good.
Okay, good. Let's see, I've osculated on the posterior and anterior chest. And the turgor was good on both front and back. Okay, now this part is the breast exam, but we're just going to talk about it instead of actually doing it. But I may get you to get into some positions for evaluation. Some of the positions is putting your hands on your hips like that. Okay, and sometimes just lean forward a little bit. Okay, now can you do your hands like that? Okay, and then another position, let's see, putting your hands behind your head. Okay, good. All right, thank you. Can you relax? Okay, let's see what all okay. Let's see, hands on hips, forearms, hands, hips together. Okay, good. No increased vascularity, stria, or lesions noted. The areola is darker in color and nipples everted. Breasts symmetrical, no masses, edema, dimpling, or retracting. Can you tell me the 4 words, please?
Brow, tulip, fun, ankle.
Good. Excellent. I thought you might remember that last word. I wasn't going to cheat and give it to you. Okay, let's see. Now to check for your axillary nodes, that's when I would have your hands behind your head, and I would feel along the midline, and the pre and the post, and feel deep into the axilla to see if you have any nodes. Now, to evaluate your breast, I will have you lay back. Are you where you can lay back at this time?
Yes.
Okay. And put your hands behind your head. And I would feel for the breasts, for any lumps or anything in the breast, by the, let's see, what is that? It's called a linear evaluation. Yes, strip pattern. And we would squeeze the nipple to check for discharge, which you should not have any by me squeezing it. Okay, if you want to sit up now. No axillary nodes palpated, no masses, tenderness, or discharge. There's an incision on the left breast from a breast biopsy. Okay, so I'm going to wash my hands now. The last part is just some talking, evaluation that I'd like to do. Okay, Miss K is sitting in a relaxed position. Her posture is erect. Body movements are voluntary and deliberate, coordinated, smooth, and even. Your level of consciousness, she's awake and alert and attentive. There's comfortable eye contact, pleasant, interesting to talk to, and she articulates well. She's dressed appropriately for this setting, the season, her age, her gender, and her social group. Clothing fits well, groomed, hair groomed, neat and clean, wearing little to moderate amount of makeup. Can you tell me what day it is?
Friday,
What's the date?
February 24th,
What year?
2017.
Okay, good. Where, what town are you in?
Little Rock,
In- Yes.
Arkansas.
Okay, all right. Okay. She has appropriate attention span, good memory recollection by able to regurgitate those 4 words back to me at 5-minute, 10-minute intervals. If we were going to be here this long, we'd do it again at 30. Okay, your exam is complete now. Do you have any questions or concerns?
No,
Okay, well, thank you so much for your time. I appreciate it.
thank you.